Amy, whenever. We've got thumbs up. Okay, well, good afternoon, everybody. Barbara Canales, Nueces County Judge. And before I begin today, I want to share in proclaiming today, it's the beginning of Hispanic Heritage Month. It's a nationwide celebration that has very special meaning for me, for Texas, and particularly for Nueces County, which we call home. And even the name of the county itself does reflect our Hispanic heritage. In the weeks ahead, there's going to be so many opportunities to celebrate and learn more about the rich heritage of our community and the significant contributions that Hispanic Texans have made to the culture, our economy, and our history of the great Lone Star State. As a Hispanic woman, I want to invite all residents to take advantage of these opportunities to learn about the heritage, the Hispanic culture. It's the strong part of a fabric that makes Texas a warm, welcoming, inclusive, and diverse state. And as the first Hispanic woman elected to be county judge and to hold this office, it is a great honor to serve in this capacity as county judge alongside another Hispanic woman, Mayor Paulette Guajardo. So it is an important time of the year, and I think it's very fitting that we celebrate throughout Nueces County given the fact that our two leaders share this heritage in common. It is a commitment to our faith, our family, and to justice that's deep-rooted in our shared culture. And it's a culture that we can be very proud of. It's one that we can all take part in, and so just celebrate the month, please, because it's an opportunity to better understand one another. And we embrace this diversity while we reinforce the bonds that unite all of us as Texans and as Americans. So, with that being our preamble, it's very important to say I want to thank Gabby as well for making this translation possible in Spanish every time we have this press conference. So, to celebrate Hispanic heritage, I just want to salute Gabby, the translation that she provides, and to our Spanish-speaking community, Telemundo Univision, muchísimas gracias. I'd also like to acknowledge those who stood ready and for aid, response, and recovery if we needed to regarding a tropical depression that turned into a tropical storm and then became a hurricane, as known as Nicholas. We stood up our emergency operations centers as a city and county. We coordinated with all our jurisdictions, with regional, state, and federal partners, and we were able to be very, very fortunate. We watched as the storm passed us by. We saw the damage that Hurricane Ida brought to New Orleans, where more than 1 million were without power for over a week. We saw the effects of New York's floods, New Jersey, where damages took not just property, but lives. Some hurricanes we watch for a week, and they come into the Gulf of Mexico from the Atlantic Ocean, as Ida did when it intensified. And then sometimes Ida is a reminder of how important it is to have the ability to respond quickly. And that goes to all of us, government, residents, and businesses. The Atlantic hurricane season, just as a reminder, runs all the way through November 30th. That seems really a long time, and I want you all to please remain very vigilant. I want to end with this, and I promise to move to COVID, but I was so pleasantly surprised this afternoon while driving that I got a call from Governor Greg Abbott, and he wanted to make sure that Nueces County was good, that we had not suffered any ill effects of Hurricane Nicholas. And so while I'm so glad to say that, and to him as well, that we did not have any strong effects other than, of course, the surge that attacked our beaches that made it impassable for 24 hours to 36 hours, we were very, very lucky. And so again, I stand grateful to all those who stand ready to respond. Now let's talk about the COVID situation. You may already have detected my mood is different. I think the last time I was at this podium, there was tremendous angst, anxiety, and frustration. And today I want to express the opposite. I want to express cautious optimism about our current COVID status. And I really want to emphasize that. I always try to tell it like it is, but today I am much more optimistic if we can continue doing what we need to do. And there is a saying on Wall Street that the trend is your friend. And right now, the trend is moving in our direction, a favorable direction. Our hospitalization rate is down for a third week in a row. We have steadily delivered monoclonal antibody treatments to those with early stage COVID experiencing mild to moderate symptoms. Our vaccine delivery rate is doubled. And I visited La Palmera Clinic today and thanked everybody who's on duty. It gives me great, really just joy to see people in there. I have people that tell me, stop telling us to get the vaccine. We don't want to be told anymore. That's okay. There are people that still want to get the vaccine. There are people that are still making decisions. We have to respect them too. So we will remind you about the hours, open every day of the week. And it is a wonderful place if you choose to avail yourself of this free, life-saving vaccine. I use the hospitalization rate as one of the key metrics to tell us how things are going in Nueces County. I'm able to talk to leaders like our governor and let him know what's happening by using data so that we can drive good decision making and absolutely share with him the resources that we are needing. The vaccination rates and antibody therapy directly impact our hospitalization rate. Let me say that again. The antibody treatments that we have been delivering absolutely affect our hospitalization rate, keeping those lower than we had a month ago. The monoclonal antibody treatments help people who are suffering from COVID stay out of the hospital. They are absolute game changers, and I want to thank the state of Texas, our Rapid Infusion Center in Robstown, Texas, along with our Physicians West Community COVID Clinic and the Nueces County Medical Society for assisting us in public health to deliver over 200 Regeneron treatments every day, at minimum. And again, these treatments help people fight the disease. They lessen the symptoms and they shorten the duration of the illness. That is what keeps people out of the hospital. And while not every one of those hundreds of treated patients would have gone to the hospital, many would have. We know that. And every patient we keep out of the hospital not only has a better outcome for themselves, but it helps us preserve capacity for other patients who have life-threatening illnesses outside of COVID or inside of COVID. Those are car accidents, heart disease, and cancer. The even better news for me today is that the increase in vaccine delivery is that 1-2 punch. And in recent weeks, we've seen more than a doubling continue. The trend continues, doubling the number of vaccines we're administering at La Palmera. In recent weeks, we've moved our overall vaccination rate from 50% to 55%. That is a good number. I'd like to see it go to 60% now. We've gone 5%, moving our needle. I'm really excited about that. And as these numbers go up, that means our community health improves. We have, when we have more people vaccinated, fewer get infected. The vaccines do their job and they protect us from getting infected. Despite the fact that we see breakthroughs, there is no doubt that the ratio of unvaccinated in the hospital to the ratio of vaccinated is lopsided. The ratio of death of unvaccinated to vaccinated breakthroughs is lopsided. So when a vaccinated person does get an infection, they have fewer symptoms and their illness is shorter overall statistics. The vaccines have shown themselves to be effective against the original coronavirus, and it does provide protection against the new Delta variant. Every vaccinated person is a person less likely to be infected with the virus, less likely to spread the virus, and less likely to become ill from the virus. Here's the one that really matters: less likely to die from the virus. So I cheer, I smile every time I see our vaccine delivery going up. These rates really make a difference, and it really is exciting to see our overall vaccination rate up 5%. Now, I said the trend is our friend, and there's another quote that I love, and that is this: your direction is more important than your speed. It's true. We certainly don't want to be going in the wrong direction, and boy, were we going in the wrong direction for too long. But since we're going in the right direction now, I do want to see things go faster. Now that we've changed our direction, let's change our speed. So thank you. Thank you to everybody who have been vaccinated in recent weeks. You are making an overall improvement in our community's health. It doesn't matter to me whether you did it in January, June, last week, or just today. Each of you are doing your part. And if you did get vaccinated recently, I really, truly appreciate what you've done. And make certain that you get that second dose. Some of you, again, were waiting for that FDA approval. Some of you maybe thought that COVID only affected the older population. We now know that the statistics don't show that. Some of you simply just now were able to make time to do it. It doesn't matter to me. Whatever happened in your life, whatever made you make that decision, I'm just glad you decided to do it. I'll never forget seeing the relief, the joy on people's faces when they came through that first drive-through clinic. I hope that you're feeling today the same level of relief and peace of mind. I pray and hope that many more of you will feel more relief when that loved one in your family decides it's time to get vaccinated. And if you do, I hope that you share your story with your friends, and whether it's, at personal time or whenever inside your own family unit, share your story about why you made a decision to get vaccinated. Because the more people that get vaccinated, the more healthy as a community we become, and the less people we have in the hospital. Each person makes a difference, and as we fight this virus and get things trending in the right direction, let's remember, let's keep that trend our friend. Please know that I am available for questions. Just reach out to me. I do have to take another meeting, but I want to introduce Director of Public Health, Annette Rodriguez, who's really going to help answer the burning question I have on my mind, and I bet on your mind. She's going to be talking to you about not only our statistics, which will confirm the trends that I have articulated, but she's also going to talk to you about some important timelines and dates with regards to boosters. So thank you again, and it feels good to say that we're heading in the right direction.
Antes de comenzar, quiero compartir la proclamación de hoy como el comienzo del mes de la herencia hispana, una celebración nacional que tiene un significado especial aquí en Texas y el condado de Nueces. En las próximas semanas habrá muchas oportunidades para celebrar y aprender más sobre la rica herencia y las importantes contribuciones que los hispanos tejanos han hecho a la cultura, la economía y la historia del estado. Y como la primera mujer hispana elegida para el cargo, es un gran honor servir como su juez del condado, junto con otra mujer hispana fuerte, la alcaldesa Paulette Guajardo. Lo que compartimos es un compromiso con la fe, la familia y la justicia. Tiene sus raíces en toda nuestra cultura. También me gustaría agradecer a quienes estuvieron dispuestos a ayudar cuando la depresión tropical que se convirtió en tormenta tropical Nicolás y posteriormente en huracán. La temporada de huracanes en el Atlántico continúa hasta el mes de noviembre, por lo que le pido se mantenga vigilante. En cuanto a la situación actual del COVID, nuestra tasa de hospitalización ha bajado por tercera semana consecutiva. Hemos provisto de manera constante tratamientos con anticuerpos monoclonales a las personas con COVID en etapa temprana, y estos tratamientos se han duplicado. Los tratamientos de anticuerpos que hemos administrado han ayudado a aminorar las hospitalizaciones, y quiero agradecerle a toda la comunidad médica. Estos tratamientos acortan la duración de la enfermedad. En cuanto a la administración de las vacunas, en las últimas semanas hemos más que duplicado la cantidad de vacunas que hemos administrado en nuestra clínica en el Centro Comercial La Palmera. La tasa de vacunación ha aumentado del 50 al 55%. Cuando se vacuna a más personas, se registran menos contagios. Toda persona vacunada es una persona con menos probabilidades de infectarse con el virus, y es menos probable que lo propague, y sobre todo menos probable que fallezca. Entre más personas se vacunen, mejora la salud de toda una comunidad.
Annette Rodriguez, Health Director. We're going to go ahead and start with the Nueces County COVID statistics. And if you see the first slide, you're going to see that over the last 2 weeks, our numbers are starting to come down, which is really great news, but they're still not low. If you notice on the far right side of me, there's 471 cases in that one day, and then you see another peak of 461. But what you're seeing this last week here is you're seeing some hundreds. That's still hundreds of COVID cases here in Nueces County per day. But again, you can see that these numbers are obviously coming down, so we're grateful for that. Next slide. So this is the pie graph, and on the pie graph, it's basically showing you cumulative from last year, March of 2020, to the present. And what we have here is a total of 63,310 individuals in Nueces County with COVID-19. 57,470 have recovered, but what we still have are 4,732 active cases here in Nueces County. And we'll talk more about the deaths. Next slide. So here on this graph, you can see the decline. You know, the concern here is that when you see a decline like this in hospitalizations, it's not always that patients are getting discharged. Sometimes you have patients also dying. And we do know that every day we're seeing COVID-19, more and more patients die every day from this terrible disease. Next slide. In the ICU, we're also seeing a decline. Again, the same is true as I just mentioned before. So from 96 to 68 could be a number of people that have actually passed away from COVID-19, and then there could be a few that have recovered. Next slide. This is a total of over 1,100 people, 1,108 to be exact, people that have died in Nueces County due to COVID-19. You know, yesterday I was on a call with the state, and they were saying that in Texas, I believe the number was over 50,000 people have died in the state of Texas due to COVID-19. And what they said, it would be the equivalent if a hurricane had hit Galveston and Port Arthur and had killed every person there, would be the number that we're actually seeing in COVID-19 deaths in Texas since March of last year. So here are the fatalities. I think you can also see that last week there were more fatalities than this week, since we have 11 and 10 on that side and 2 9s. Over here we have 4s and 2s. These are still people that are dying in Nueces County from COVID-19, so we're still seeing high numbers of deaths every day. I'm going to shift a little bit and talk about what's going on at the health district. So in the month of September alone, we have had 4,051 positive COVID-19 cases. That's 4,000, over 4,000 in just, half of a month here. That's a lot of cases. Again, I think if you remember during the lull when people were starting to travel, we had around 140 cases a week, and now we're seeing closer to 2,000 cases a week. And so that's a big difference. The numbers are coming down, but they're coming down gradually, like Dr. Bird talked about last week. It's not plummeting down like they they had a rapid increase. Now they're coming down slowly and kind of spreading out. We've had 85 deaths just in the month of September alone. What we are seeing currently is that plateauing in cases and hospitalizations in Nueces County. But we should remind people that this is not the time to just say, oh, okay, everything's good again, I can take off my mask. So we actually really need to concentrate and think about the next wave that is coming. Even though we're still in this current third wave, we need to start thinking about the one that's coming in the wintertime and how we're going to approach it. Now that we've become so much more smarter, if you will, so much more knowledgeable in COVID-19, we should be able to kind of bring that wave down and not have such a high peak right after Christmas time. So we're really going to talk about different things that we can do to keep that next wave low. COVID-19 vaccines remain vital to ending this pandemic. Vaccines continue to provide robust protection against hospitalizations and deaths, even after the highly contagious Delta variant became the dominant variant in late June. If you aren't fully vaccinated and you get COVID-19, your risk of being hospitalized or dying is actually more than 10 times higher than that of someone who is fully vaccinated. And I want you to see this slide here because I think it's so important. This is from CDC, and it says, after the Delta became the most common variant, fully vaccinated people had reduced risk of infection by 5 times. They had reduced risk of hospitalizations greater than 10 times, which is really phenomenal just by getting vaccinated. And they had reduced risk of deaths by greater than 10 times as well. So I think this is a really important slide, and we need to think about that, especially if you're still unsure whether to get vaccinated or not. The health district is preparing to provide Pfizer booster doses as well as vaccines for those children under the age of 12, pending our guidance from the FDA. Once the final recommendations have been released, we will provide guidance to all of you on how to access these vaccines. If the FDA authorizes a booster dose, people who were first to receive a COVID-19 vaccination when they became available in early 2021 are likely to be the first people eligible for a booster. This includes healthcare providers, residents of long-term care facilities, and other older adults. The recommendation is to receive, what we're hearing is to receive a booster 8 months after your last dose of the vaccine. And so here's the slide, because I think it's important. People have been asking, do we come September 20th? Are you open on September 20th? Is that the date that we get our booster? And the answer is no, but it's yes for some. And so if your last dose was in January of 2021, so you had your first dose probably in December of 2020, and then you had your second dose in January of 2021, then yes, your booster, if FDA approves it at the end of this month, you would be one of those fortunate people that would be first to get your booster because you've already been 8 months out from your second dose. But if you had your second dose in April, and right in the middle it has April 2021 there, you wouldn't get your booster until December. And so you wouldn't be there September 20th trying to get your booster because you know that you still have high antibodies, you still have good protection against the vaccine, and it probably wanes around December of 2021, and so then you can come in December and get your booster then. Again, this is pending the FDA recommendation, so we have to make sure that this is still the guidance that they're giving us. Sorry about that. Okay, so I'm just going to add a little bit of clarification on a third dose and how it's different from a booster. So a third dose is for people who haven't mounted a sufficient immune response to the first 2 doses or to the 1 J&J. So, and that actually puts them in a category that we call them immunocompromised. These are individuals that are taking chemo or other drugs that are keeping their immune system suppressed. So those individuals, they can already go right now to the mall or to CVS and they can get a third dose. That is not the same as a booster. The boosters have not been FDA approved for anyone. I'm having a lot of people telling me, well, I can get a booster here or there. We all get the vaccines from the same place. So if they're not approved for the health department, they're not approved for anybody else. Now, the booster shot is for people whose immune response likely weakened over time. It's also called waning immunity. And those, we would all fall in that category. After so many months, maybe the vaccine starts to wane, starts to weaken, and so they tell you after 8 months or after 9 months or after a year, you need a booster. Then they'll approve it, and then we'll open that up for people that want to get their booster. We also continue to provide Regeneron, which is a monoclonal antibody treatment, like the judge mentioned, for mild to moderate COVID positives. Regeneron's therapy, again, can protect you, and it's shown to have 70% effective at avoiding hospitalizations and death. So it's something that if you become positive and you're thinking about, I heard her say something about we could get something, an antibody, call the health department, 561-1101, and we can help get you into a treatment location either at Physicians West, which is close to Memorial Hospital, or at the Richard Borchard Fairgrounds. As always, I want to stress that these numbers are much more than just statistics. These represent people, individuals, whose loss is a source of grief for so many here in our community. And I want to extend my deepest condolences to everyone who has lost a loved one to this virus. So, and I'm going to end it with these two slides because I think these two slides are so impactful. So this fully vaccinated. It's been more than 2 weeks after their last vaccine, and we had 39 people that ended up in the hospital even though they were fully vaccinated. So I also want to say that many times these individuals are the ones that are lucky because they have much more moderate symptoms, and they end up getting discharged and they get to go back home to their family. So as always, stay safe and always stay informed. And then I will turn it over, once Gabby does the translation, to Dr. Bird. Thank you.
El día de hoy se reportan 213 casos positivos al COVID. En las últimas 2 semanas estas cifras han aminorado, aunque aún hace falta hacer más. Actualmente existen 4.732 casos positivos, 57.470 personas se han recuperado por completo, 265 personas se encuentran hospitalizadas, 68 de estas en la unidad de cuidados intensivos. El día de hoy se reportan 3 fallecimientos, totalizando 1.108 muertes desde el mes de marzo del 2020. Solo en el mes de septiembre hemos tenido 4.051 casos positivos por COVID y 85 muertes. Aún no estamos fuera del alcance de la cuarta ola de la pandemia. Las vacunas siguen siendo vitales para poner fin a esta pandemia y está brindando una protección sólida contra la hospitalización y sobre todo la muerte. Si no está completamente vacunado y se contagia por COVID, su riesgo de ser hospitalizado o morir es de 10 veces mayor que el de alguien que está completamente vacunado. Esta cifra de acuerdo a los Centros de Control de Enfermedades. El condado de Nueces se está preparando para proporcionar dosis de refuerzo de la vacuna Pfizer. También esperamos contar pronto con la aprobación de esa vacuna para niños de edades entre 5 a 11 años. Si la Administración de Alimentos y Medicamentos, la FDA, aprueba la vacuna de refuerzo, entonces las primeras personas en recibirlas serían aquellas que recibieron la vacuna a principios de este año, incluyendo proveedores de atención médica, residentes de centros de atención a largo plazo y para adultos mayores. La recomendación es recibir un refuerzo 8 meses después de su última dosis, o sea, la segunda dosis para aquellas personas que recibieron la vacuna Pfizer y Moderna o la única dosis de Johnson & Johnson. Cabe aclarar que una tercera dosis o una dosis adicional es diferente a un refuerzo. Una tercera dosis es para personas que no han desarrollado una respuesta inmune suficiente a las 2 primeras dosis, mientras que una vacuna de refuerzo es para aquellas personas cuya respuesta inmunológica probablemente se debilitó con el tiempo. Seguimos proporcionando Regeneron, que es un tratamiento con anticuerpos monoclonales para pacientes positivos a COVID con síntomas de leves a moderados. La terapia de Regeneron puede brindar protección contra enfermedades graves, aunque no sustituya la vacuna. Este tratamiento ha demostrado ser 70% efectivo para evitar una hospitalización debido a los síntomas del virus. Para más información, puede comunicarse al número 561-1101.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team. We have two objectives on the modeling team. One is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. And let's get right into it with the case counts. It's a little bit different this week. I logarithmically scaled the axes. What that means, instead of 1, 2, 3, it goes 1, 10, 100, etc. It lets you see patterns sometimes that you can't see the other way. So we have trends going downwards in all of the age classes in the 20-year age bins, with 0 to 19-year-olds having the most cases still, 20 to 39-year-olds second most, 40 to 59-year-olds the third most, and then 60 plus the fourth most. When you compare the vaccinated on the left versus the unvaccinated on the right, you can see there are many, many more people who are unvaccinated that are testing positive than unvaccinated, as you saw in that previous graphic shown by the public health director. So cases are declining. The majority of cases are in the unvaccinated. Now, I zoomed in on the younger age groups because a few people gave me feedback and they were like, well, what's happening with people 0 to 11 years old who aren't eligible for a vaccine versus people who are older that are? And I kind of broke this out: 0 to 11, not eligible for a vaccine, high school aged up to 17, and then college aged up to 21. And you can see that, again, there is a youngest has the most cases to oldest has the fewest. Now, that being said, there's different numbers of years in each of these groups, so really the trend is what matters the most, and that all these age groups are trending downwards, and that's the important thing. And again, unvaccinated have many more positive cases than the vaccinated. All right, moving on to the model. And here I'm showing the model calibration, and what we do is we model the number of actual infections in the community, which we're up to over 15,000 at one point in time, and we're down now, at least the weekly number of new model infections, we're down to around around 7,000 new infections weekly. And we relate that to the number of cases. So that's the key thing in this graphic. So the orange are the infections, the black are the actual cases. We calibrate the model together. And what you can see is that while last week we plateaued, we stopped declining, we're now going downwards again. And so that's a good sign, just like you could see in some of the previous graphics from the public health director. So, and they're declining pretty rapidly right now, so that's a good thing. And I want to address a question that the public health director asked me last week, and that said, hey, what would have happened if there weren't people getting vaccinated? What if we didn't have a vaccine? How do we know how important the vaccine has been in affecting this curve? Because we still had this big peak, right? We're still in the middle of a big outbreak of COVID-19, even with the vaccinations. What would have happened without them? So we did two scenarios. One is our present projection in blue, and the other one is what would have happened without the vaccine. And I didn't get too complicated with this. I just adjusted the number of susceptible people in the community based on whether I just subtracted out all the people that got vaccinated and said, what if they didn't get vaccinated? Then how many susceptible people would we have in the community? And we ran the model like that. So that's the red. All right. And so for the ICUs, right now we're trending downwards. As you've seen, that's in the blue. We peaked out at nearly the most number of people in the ICU that we've had, but not quite. It was a little bit higher back in July of 2020. But if we didn't have anybody get vaccinated, if there was no vaccine, the peak this summer would have been much, much higher, about 45% higher than what we saw, and much higher than anything that we've seen in the past. So there would have been a much higher hospital load, and really, I don't think that our hospitals would have been able to deal with that many additional people in the ICU. The second one here, we've got the number of inpatients. Again, what's actually happening in the blue versus what would have happened without the vaccine is very different. It's actually 48% higher number of inpatients in the hospitals if we didn't have the vaccine versus if we did at the peak. And again, we have very few empty beds in the hospitals right now that have people to staff them. So if we went this much higher, for sure, it would have negatively affected health outcomes in our community. So the vaccines are having a huge effect on how big this curve was. Now, one of the reasons why this is important is we already have, just with the way things are now, we have 30% of the capacity of the hospital is taken up by COVID patients right now. It's very high. At one time, in the not too distant past, just half of that would have triggered additional mitigation measures such as businesses rolling back capacity and things like that. So even though things are going in the right direction, this is still a large amount of stress on the hospitals. And I think this graphic shows it even better. This is the vacancy in our inpatient hospital beds. We're at 2.5% of the staffed beds are empty in our hospitals. That's very low. All you have to do is compare back through time, through the whole pandemic. We haven't seen anything like that until right now. So imagine what would have happened if we didn't have the vaccines. This would be 0%, and there'd be people in the parking garages and tents around the hospitals. So the vaccines definitely had a big impact. Here we have the trend in fatalities. It's still going up. Right now, the blue is our present projection. You can see the black dots are already going up a little bit higher than the projection. These black dots, they're reported by the state, and they're people counting death certificates at the state that have COVID-19 as the primary cause of death. And what you'll see is that even our projection is really undershooting the peak right now. And while it looks like the black points are dropping, they're just not all counted yet. I don't know how high they'll actually go, but we estimate that when we get everything counted, the peak will be at September 3rd instead of a few days before, like what you see right now. And it'll probably be quite a bit higher than the blue curve that you have there. Given this fatality rate, if we didn't have vaccines, there'd be about 100% more fatalities than we're seeing right now, or 2 times as many. So again, the vaccines pretty much have the number of fatalities that we would have seen at the peak in this particular Delta wave. So in summary, vaccines work. I don't know what happened to my first bullet point there, but it disappeared. It was supposed to be the vaccines work. And I think that this showed it. Imagine if we had 70%, 80%, 90% of the people vaccinated. We wouldn't even call this a wave anymore. It would just be a ripple, maybe. It probably wouldn't have interrupted our lives the way it was, and I probably wouldn't be here talking to you right now if we had vaccination rates at that level. New cases and hospitalizations are declining, and that's good, but the hospitals are under a lot of stress. As you saw, 2.5% of inpatient beds that have staffing are empty. The other, 97.5% are full. And that's very abnormal. Oh, there it is, vaccines work. I don't know why I did that. All right. Fatalities, they're still being counted. So while you saw what looked like a peak, it's a false peak. And there's so many fatalities right now from COVID that normally it takes the state 14 days to count them all. We're at, maybe 28 days it's taking to count them all right now. So they're overloaded. We have some basic recommendations. If you're symptomatic, self-isolate, number 1. 2, get tested. 3, if you test positive, get the free monoclonal antibodies. Is that still available in that? Yeah. All right. I didn't see anybody talk about that today, but this is, getting the presidential treatment. Usually in most parts of the country, you have to pay a lot of money for these monoclonal antibodies, and usually only rich people can get them. Here, anybody can get them for free. So get that presidential treatment if you test positive, get the monoclonal antibodies. You can call the public health department, and after calling them, walk in, or you can get your doctor to refer you. If you're not positive, mask up in public, especially inside. Social distance, get vaccinated. These are the things, these are the tools at our disposal right now that can help end the pandemic, help flatten the next wave, help bring down the current wave that we're on, which is not over yet. As you saw last week, things could change very quickly from going down to leveling off or even going up. So that's it for this week. We'll update you next week, and thank you very much for your time. We'll have a translation, and then the public health director will come and answer any questions that you might have. Thank you.
La mayoría de los casos positivos reportados en el área de la costa es de pacientes quienes no se han vacunado, aunque los casos están declinando, especialmente para menores de 21 años. El decline de los casos se ha reportado en la última semana. Se estima que sin la utilización de una vacuna, el número de casos positivos sería 45 veces más alto. Los casos de las hospitalizaciones también están disminuyendo, pero aún así continúan impactando los hospitales. En resumen, las vacunas funcionan, los casos nuevos y las hospitalizaciones están disminuyendo. Los fallecimientos aún están contabilizándose por parte del Estado y las cifras van a continuar aumentando. Las recomendaciones para evitar contagios siguen siendo las mismas. Si cuenta con síntomas, se le pide aislarse, se le pide hacerse la prueba del COVID. Si resulta positivo, obtenga el tratamiento monoclonal lo más pronto posible. Le recordamos que ese tratamiento es gratuito y se necesita una referencia médica. Si usted no cuenta con una referencia médica, se le pide llamar al 561-1101. Se le pide que siga utilizando su cubrebocas, practique distanciamiento social y sobre todo vacúnese si aún no lo ha hecho.
Thank you. Are there any questions? The boosters, we originally heard September 20th, but now we're hearing that the FDA is going to meet September 17th maybe or early next week. And so it sounds like it may be delayed, but once we hear, we will pass that information on to the community. All right, thank you. Seeing no other questions, thank you for being with us, and we will see y'all next Wednesday at 5 p.m. Thank you.